Hi everyone. Myself Dr. Sharath Kumar GG, Senior Consultant Interventional Neuroradiologist at Apollo Hospitals, Bangalore. On the occasion of World Stroke Day 2022, today in our panel discussion, we have renowned stroke specialists from the different parts of India to discuss about the comprehensive stroke management, that is from the diagnosis to treatment. Firstly, I would like to welcome panel member Dr. Sukalyan Purkayastha, Head of the Department, Endovascular Surgeon and Neuro-Radiologist, Institute of Neurosciences, Kolkata. Welcome you, sir. I also welcome Dr. Vikram, Huded, Head of the Department, Neurology and Stroke, Narayana Hrudayalaya Hospital, Bangalore. Finally, I would like to welcome Dr. Nitin Dange, sir, a renowned neurosurgeon from Lilavati Hospitals, Mumbai. So we all know that stroke is a major global public health problem. India being the second populous country in the world, and like other developing countries, we are in the middle of the stroke epidemic. Every year, more than 1.8 million people in India suffer from stroke and is currently one of the leading cause of premature death and disability. However, only few of the stroke victims know about their symptoms and very few reach the right hospital within the right time. So let me start my first question addressing to Dr. Sukalyan, sir. Sir, can you let us know, our audience, what exactly is the stroke and what are its symptoms? Over to you, sir.
So thank you very much. To answer your questions, I should start by saying that the brain is the controlling center of our whole body, and it needs constant supply of nutrients and oxygen. The nutrient means glucose, which are provided through the blood. So the cutting of blood supply to the brain will lead to the death of the brain cells. And with each passing minute, the huge number of brain cells are at risk. And this condition is called stroke. So stroke is a sudden brain attack. And it could be due to two reasons. Firstly, a sudden blockage of the blood vessels in the brain, commonly referred to as the ischemic stroke. And that happens because of a tiny clot which blocks the arteries. And secondly, the second type of stroke, which happens because of the bursting of blood vessels, which is commonly known as hemorrhagic stroke. Ischemic stroke counts around 87% of all stroke. And stroke can be identified by FAST. We call it FAST. And the symptoms are like F stands for face drooping. A stands for arm weakness or leg weakness. S is for speech, difficulty in speaking. And time stands for that you should not waste any time and go to a center where the stroke is treated. Thank you.
Thank you, sir. Thank you for explaining the stroke symptoms in the simplest and the best possible way. I'd like to go to the next panelist, Dr. Nitin, sir. Let us know to the audience, what are the potential impact of the stroke on the human body? Please, sir.
As we all know, brain is an extremely complex organ that controls whole body and its functions. If a stroke occurs and the blood flow cannot reach a region or a part of the brain that controls a particular function, that part of the body won't receive or work as it should be. The effects of the stroke will then depend on several factors, including the location of where is the obstruction and how much brain tissue will be damaged or affected. However, because of one side of the brain controls the opposite side of the body, as we all know, a stroke affecting one side will result in neurological complication on the side of the body it affects. So what it means is, if the stroke affects right part of the brain, the left half of the body will be getting affected or losing its function.
Thank you, sir. That's indeed complex and an important piece of information as well. So let me go to Dr. Sukalyan, sir, again. Sir, what are the technologies or techniques available to treat the stroke victims?
There are two types of treatment options, depending on the patient's condition and the severity of the stroke.
Yes.
And if a patient presents within 4.5 hours of symptoms, symptom onset, a drug commonly known as IV TPA can be administered through the patient's vein over an hour. And in an attempt to open the blockage of the drug cannot be given if the patient reaches beyond 4.5 hours. So this treatment is only limited if the patient comes very early. So for those patients who are coming beyond 4.5 hours, a very important and very effective technique called mechanical thrombectomy, which is available nowadays, and it can be done. And it is strongly recommended for the patients in whom the large vessels are blocked. And this procedure can be done up to 24 hours also, depending on the patient to patient. We need to select patient, and we have a very strict selection criteria for that. And in this procedure, the doctor uses a tiny device called stent. We call it stent retriever, which is positioned across the clot in the brain vessel, and we take it out. And also we sometimes use a suction device called suction thrombectomy. So these are essentially two devices, two modes of treatment with which the clot from the brain is taken out. Thank you.
I'll go to the next panelist, Dr. Vikram. Sir, what are the challenges in the stroke care pathway that has resulted in hardly 1% or less than that penetration of the mechanical thrombectomy? So what is the reason? What do you think about it?
Yeah,
What's
the
your opinion,
challenges
please?
can essentially be categorized into 4 buckets. First is awareness and education. This is a most important factor, as lot of people and doctors are not aware of the symptoms of stroke and criticality of treatment window. Often the stroke symptoms are also misinterpreted by the GPs or the EMS staff, which leads to delayed prognosis. The need for doctor community to be aware of the symptoms of stroke is as important as general public. So this is the first challenge. Second is the access. Due to lack of coordination, referral pathways, and poor availability of the emergency transportation service for stroke, the patient do not have the access to the therapy. Third is infrastructure. There is a shortage of treating neurointerventionist, whether they're intervention neurologist, endovascular neurosurgeon, or intervention neuroradiologist. And also, there is a lack of availability of comparative stroke centers, which leads to treatment delays. Third is affordability. I think affordability comes last because what we get, that second life or the disability-free person, which is this modality is one of the strongest evidence in medicine. So compared to that, the cost is not that important. And now even some of the government schemes are covering this procedure. And also now after COVID, the general public are aware and they are taking even a lot of private insurance.
Thank you, sir. Thank you for highlighting the bottlenecks in the treatment of stroke management. Very important piece of information. And coming to the Dr. Nitin, sir. So, Dr. Vikram has already explained what is the importance of correct treatment in the correct time at the correct reaching the correct hospital at the appropriate time. Would you like to give us information about what is comprehensive stroke center and its importance, please?
Yeah. So basically what Vikram has just stressed upon, the need of the hour is comprehensive stroke center. Because stroke usually are needed to be treated on emergency, we need to have a team set up. And it involves basically a hospital comprehensive center would ideally designate or be named if it is well equipped a hospital with 24-hour emergency, a team of specialized experts, CT MRI facility, and capability of specialized surgical as well as interventional therapies. The initial treatment consists of complete patient evaluation, and brain scan using either MRI or CT scan to understand the type of stroke. Along with the infrastructure, it is very important to have a well-defined protocol and qualified workforce to treat such a complex disease called stroke. Early treatment definitely plays an important role, improves the chances of full recovery, and also reduces the disability. Thank you.
Thank you, sir, for again reinforcing the importance of patient reaching the right hospital at the right time to get the best desired results. So, final question to Dr. Vikram. As we all know that we are celebrating the World Stroke Day on 29th October every year. So what does the World Stroke Day mean to you?
So every year, World Stroke Day is observed as on October 29 to emphasize the serious nature and high rates of stroke. So according to World Stroke Organization, 1 in 4 people will have stroke in their lifetime. So the day is also observed to raise awareness of the prevention and treatments of stroke. The theme for World Stroke Day is Save Precious Time. Time is of utmost importance when we talk about stroke. We want to communicate what can be saved, a life, but also independence, quality of life, and precious memories.
Thank you, so wonderful. Thank you everyone for this interesting session and for informative inputs. This will definitely help our audience and hopefully further our aim of spreading awareness about the stroke. I once again thank all the panelists on behalf of ET Healthworld for this opportunity to create an awareness program on the stroke on this auspicious occasion of World Stroke Day. Thank you everyone. Have a wonderful day. Namaste.
Stroke is a leading cause of death and disability. Around the world, someone has a stroke every 3 seconds, so it is imperative to know the symptoms. What are the symptoms? Remember fast to spot stroke signs: facial drooping, arm weakness, speech difficulties. Acute ischemic stroke occurs when an artery to the brain is blocked. The brain depends on its arteries to bring fresh blood from the heart and lungs. How is an acute ischemic stroke treated? There are several ways acute ischemic stroke can be treated. Medical management with IV TPA. IV TPA is the clot-busting drug used with stroke patients. Patients must be indicated for the drug and have the drug administered within the appropriate time window. A minimally invasive procedure called mechanical thrombectomy. This procedure uses a stent retriever and/or an aspiration catheter to remove the blood clots in the brain to restore blood flow. Mechanical thrombectomy can be performed in combination with IV TPA or can also be considered if the patient fails IV TPA or is ineligible for IV TPA. Let's take a closer look at mechanical thrombectomy using both a stent retriever and aspiration catheter. During the procedure, a catheter is introduced into an artery at the groin and guided up through the neck until it reaches the blood clot causing the stroke. Using X-ray guided imaging, a stent retriever is inserted into the catheter. The stent retriever crosses past the clot, then expands to retrieve the clot and begin restoring blood flow. An aspiration catheter is inserted near the clot to apply vacuum pressure, while both devices are withdrawn together.